Dr. Kyle Bonesteel is the president and founder of Neural Health Associates in West Suburban, Illinois. He's only one of approximately 40 board-certified neuropsychologists in Illinois. He's recognized by the American Academy of Clinical Neuropsychology. He's the vice president of our board of directors of the Illinois Association of Prescribing Psychologists, and he's the 7th Illinois prescribing psychologist. Dr. Bonesteel will talk to us about his unique brain mapping work and how he combines his expertise in neuropsychology so that he can provide the most comprehensive and expert treatment to his patients.
Hello, everyone. My name is Kyle Bonesteel. I'm a prescribing neuropsychologist here in Oak Brook, Illinois. And first of all, I'm so sorry that I couldn't make it in person this evening, but wanted to say a few words about my journey and the experience of being a prescribing psychologist. One of the things that I've really enjoyed about this process is the people that I've gotten to meet, the mentors that I've had an influence on my skill set development, and really just the interesting things that you learn when you're going through this process. Clinically, I have very much appreciated the ability to uncover underlying etiologies that are contributing to patient symptoms, whether that be through running labs or cheek swab testing for pharmacogenomic testing, ruling out genetic components like an MTHFR polymorphism, and some of the other things that you get taught to do when you're becoming a prescriber. And so that has, I believe, increased my sophistication in terms of appreciation of all the different things that can influence a patient's mental and neuropsychological health. The other thing that I really like about being a prescribing psychologist is the ability to open up the playbook, whether that be exploring supplements that may be helpful, nootropics, medicines, unprescribing if the pharmacological regimen doesn't appear to be fitted to the patient's psychological or neuropsychological profile. Neurofeedback, biofeedback, different types of psychotherapeutic interventions. So it really can become a full service delivery of mental health and quality psychological services. The other thing that it was interesting for me, and it occurs to me, is that the grass isn't always greener, but it can be green on both sides. In other words, when a profession like ours has historically not been allowed to prescribe, I think it's natural to feel like we're missing out or the grass is greener on the prescribing side. And I will say that the grass is green over there. But the grass is also green on our original side as well. The ability to be a psychologist, to use psychodiagnostic tools and measurements and assessments and statistics and projective and objective methods, and knowing about neurological and neurocognitive functions and diagnostic interviewing and being skilled in a variety of different psychotherapeutic approaches and ways of conceptualizing cases. These are tremendous strengths of our field, and I don't think that I have ever appreciated that more than I do now, because prescribing medicine can be a game changer for people. But having that entire skill set from start to finish, diagnostics as well as psychotherapeutic skills, is really something that I just really appreciate about our profession. I think we've done it the right way. I want to give you just one example of a case that through medication management really turned around in a beautiful and wonderful way. I had a 21-year-old who had been through some trauma and had a brief acute psychotic episode that in retrospect was probably also related to a transient period of drug use. She's a great young lady, but was struggling immensely. She'd come to me after several medication trials, diagnosed initially with a bipolar 1 versus schizophrenia rule out. Well, as it turns out, we ran some diagnostics, some tests, and that diagnosis actually wasn't correct. But being a psychologist and being able to assess with scientific measures really helped my clarification of what was and what wasn't going on with this particular patient. What we ended up doing was putting her on a non-stimulant ADD medicine called atomoxetine, a brief trial of benzodiazepine medicine to get through the ongoing and acute anxiety-based symptoms, and moving her into an SSRI and augmenting that a little bit with some trazodone for sleep. Long story short, this young lady went from not being very functional at all and pretty darn miserable to getting back to school, finishing her degree, and now has a really great job at the age of 22 that she is just very pleased to be moving into and having as a very important part of her development in her life. So that's just one example of many where the right recipe can really turn a person's life around. And it's really an honor to be able to deliver that to people in the way that a prescribing psychologist can. So I would encourage you all to feel free to reach out to any of us, and certainly feel free to reach out to me with any questions, or if you want to understand what my journey was like, happy to share. And certainly also want to give a great big thanks to Taylor Huey, as well as Beth, for all that you have collectively done to move this RXP movement from an idea to a reality. And I promise I will be there next time in person, or at least live by Zoom. Thank you, everyone.